okay? Palpable structures on the scapula, acromion, spine, medial border, inferior angle, and at least a portion of the lateral or axillary border, okay? Sometimes we can get the superior angle, sometimes not. There's a lot of muscle attachment in that area. And coracoid process anteriorly. Okay, so those are the structures that we're going to be able to feel on here. Everything else is either buried in muscle or on a surface that's, for instance, as up against the ribs. You can't feel it at all. You can kind of. You get your fingers underneath there, but you don't do that just for the sake of doing it because you're not going to feel bone anyway, are you? What are you going to feel in here?
Muscles.
What, two muscles?
Infraspinatus. I mean, subscapularis.
And?
Not the rhomboids?
No.
Not in here.
Transverse or the, what is it called?
I asked you.
I know the spinatus or transversal spinatus.
The what?
Serratus.
Serratus.
Serratus anterior.
Subscapularis filled right up there, right? Okay. Woo-hoo-hoo. All right. So those are the structures. Okay, Cassie's going to help us out. So we'll have you remove your shirt there, your jacket. Have her sit up here. Now, I usually palpate with the person sitting to do this. Occasionally prone, never supine. Right. All right. So if she's sitting up like this, and you can just kind of go, oh, that's kind of hard to see. So what I always will do, if the person is able to, is this, and I'll just relax your arm. See what happens? And she does that. And in almost all of us, that's going to occur. So what I will do is have them put their hand behind there, relax their arm down, and it wings the scapula, brings it right up off the trunk, so I can actually
Oh my gosh, ow.
I can feel anything that I want to. It's just it's pressure.
I like it.
And most people will say it feels good. So if I can get that far up underneath there, I can feel a lot of things. And people identify.
The subscapularis.
Yeah, I can. That's what I've got my fingers on right there. It's right there. Okay. So I'm going to start over here. I can actually, right here, feel her superior border. Just inferior to the bands of middle trapezius right here. Okay? So I just go in and push and go, there it is, right there.
Angle or border?
Angle. Okay. Yeah. And then I can feel the entire medial border with her in this position. I can find the inferior angle right there. And now here I've got muscle. Okay, I've got teres major, infraspinatus, teres minor. All that stuff is right there. So what I have to do is just kind of push in a little bit, and I can find the lateral border clear up there for her, because she's lean. Okay, some of you won't be able to feel it that far up, but I can feel all of that axillary or lateral border up to there. Okay, I'm going to come back here. I'm going to feel the spine of her scapula, right all along here. So it starts right here at the root of the spine. I can roll up here, ooh, soft, roll down here, ooh, soft, and this is hard. There's the bone right there. Okay, follow it all the way out until I find the acromion, which I have got captured between my finger and my thumb. The acromion is that big. If you like to do is just look at the skeleton. And you see it's a ledge of bone. This is the posterior portion of it. There's the lateral portion of it right here, and there's the anterior portion. Okay? Then at this point, go ahead and relax. What I'm going to do is have her lay down, which is usually easier to find the coracoid process because I don't have all those degrees of freedom to worry about. Okay? So she's all relaxed now. She won't be in a second. Okay. The coracoid process is this bit of bone that peeks through to anteriorly. This is all screwed up. It's this hook of bone, okay, that pokes through here. The way to find that is to first find her clavicle, because it's going to be inferior to the clavicle. Second, I just kind of eyeball where the mound of her deltoid muscle is right here, okay? This is called the deltopectoral interval right here, because we've got pectoralis major here and deltoid here. And when we palpate the muscles, then we'll come back and go, yeah, this is easy to find. So right in here, inferior to the clavicle, just medial to the mound of her deltoid, I'm going to start pressing around. And I can find a bump right there. A bump which, if I press on it like this, is a little uncomfortable for most people. I kind of want to draw away. Okay? But she's a warrior because she has a 1-year-old now. So she didn't pull away. But for some of you, you won't like that at all. but it's a knob. It feels like the end of your thumb sticking right there. If I go too far over here, I'm going to feel a bump right there and a bump right there. Those aren't what I want, right? What are those?
Greater and lesser tubicles?
How am I going to tell the difference between this, this, and this?
Find
One
out
will
all
move
about
and
the-
one
What?
won't.
Yeah, that's what I was thinking. Does one move?
If I do this, if I'm on something that moves, see how my finger rolls around that? See what's going on underneath her? Watch. See that? You see all that? I'm on her arm, aren't I? I'm on a humeral structure. Most likely that's the lesser tubercle. Okay. I have to come more medial. Oop, there it is. That doesn't move at all. See that? So now that's how I'm going to distinguish between those bumps, because in some of you the bumps are close together. Some of you they're not. But come as medial as you can and just do this real quick, and if you do not feel it moving, you'll feel movement. What is it? Soft tissue, because there's tendons attached to that. You know the difference between that and a bone. If the bone doesn't move, then you're on the coracoid process of the scapula. Okay? So those are all the structures that we want to palpate on the scapula. It's not hard, huh?
All right.
Okay?